And of course in the studio with us at the moment we've got Jeff and Wayne, and today's subject, gentlemen, a bit of a controversial one, I think.
It's been yes, fun, yes. Today we're talking about men's sexual health, Richard.
And of course that's a subject that a lot of blokes don't even really want to know about or talk about unless they're having a couple of beers with their mates down the pub.
That's correct, that's correct. But yeah, this is an issue over the past decade that has received a huge amount of media and sales attention and impacts the lives of millions of Australians, men and women. With us today we have Wade Stiller. Wade is a Bachelor of Health Science in Naturopathy and is trained in both herbal and nutritional medicine, and currently practices at the Northside Wellness Clinic over at Petrie in Brisbane. Welcome, Wade.
Hi Jeff, hi to our listeners, thanks for having me.
So tell me, what exactly are we talking about when we're talking about men's sexual health?
Well, Jeff, there's three main complaints, I suppose, or areas that we can talk about and we'll touch on today. The first one being prostate health, and more specifically benign prostate hyperplasia. The second would be functional disorders like impotence, and the third would be looking at loss of libido or libido insufficiency. Now, of course, there's the area of cancers, impacts very, very strongly on men's sexual health. And of course, complementary medicine can offer some excellent support there, but cancers that fall under this male sexual health category are a completely separate issue really to what we're going to talk about today, and they do need medical diagnosis and treatment. So although they're a part of the subject, we won't really touch on them today.
Okay, Wade, so tell me a bit more about benign prostate hyperplasia. How is that different to an enlarged prostate, mate?
Well, it's not. They're both the same thing. But let's just call it BPH instead of benign prostate hyperplasia. Much easier.
Yeah, it's good because I was having trouble pronouncing it.
All good. Look, so to explain a bit more, just to extrapolate on the name, benign means not reoccurrent or not malignant, and in this case it basically means that it's separate from the rest of the body. Prostate obviously is the organ in question. Hyperplasia, just a nice big medical term. Hyper meaning over or larger or above, and plasia is the formation or growth. So in simple words, BPH is the enlargement of the prostate cells or the rate of the growth of those cells that doesn't have a direct and current threat on of spreading to the rest of the body. So being confined, there's an enlargement of the prostate, which is a small gland that sits just under the bladder. Actually, the urethra of the bladder goes through the middle of the prostate, which is why we get symptoms of BHP that are, reduction of urine flow. So difficulty passing urine, a weak stream, feeling like you need to go after you've just been, waking up multiple times at night to, go and do a wee, burning during urination, urgency. They're all symptoms to be aware of. And of course, the prostate's in fairly close proximity to the colon. So feeling as though your stools aren't complete, all the way through to lower back pain, can all be symptoms that are associated with BPH.
There really are a lot of symptoms here, mate. Is there a specific test to confirm BPH?
Look, yes, medically there are a couple of things that can be done, but most of us males, especially as we get older, we're quite aware that the first diagnostic tool is the digital rectal exam. Yes. So most men do shy away from having these things looked at in the early stages. A PSA is a simple blood test that can be performed, and I definitely recommend men ask their GP about that if they're worried about the health of their prostate but too uncomfortable to have the digital exam just at this point in time. And usually once confirmed, things like ultrasounds, they can be performed to see the rate of progression and see where things are at.
Okay, but what age should people be getting checked for these sort of things?
Oh, look, off the top of my head, people, they say 40 to 50 you start to get looked at for these kind of things. These days though, BPH is becoming more and more of an issue for the younger males. So really it comes down to symptomology and other things that are associated. It can be one of those tricky things.
Okay, so where does BPH come from?
Well, specifically, science is still kind of searching. I'm sure there's a there's a team of scientists out there somewhere looking for the prostate enlargement gene or something like that. But what we do know is testosterone increases the growth of the prostate, and it's essential for healthy prostate function. Of course, testosterone is produced by the testes. We also know that testosterone in the body converts to dihydrotestosterone or dihydrotestosterone, which we're just going to call DHT. Again, it's another one of those big words that it's easier to just break it down into a couple of letters. Now, this is responsible for things like facial hair, a receding hairline, and baldness, and acne during puberty. That's the DHT. So it's this DHT that also contributes to the prostate enlargement. So the two things that we look at, number one, is there too much testosterone in a male? And number two, is the testosterone converting to DHT at a too high a rate? Now, for those of us who think a little broadly, or a little more broadly, there's also the problem with the body clearing and excreting DHT or testosterone. We certainly take those into account as well.
Okay, Wade. What can be done about this, mate?
Look, to me, the first protocol is decreasing that conversion that I was talking about of testosterone to DHT, which is done by an enzyme called 5-alpha reductase. This can be inhibited by things like zinc or quercetin, GLA or gamma-linolenic acid, just to name a few. And there's also some medicinal herbs that we can use as well that inhibit 5-alpha reductase activity. There's a few men out there there's very few men out there that I've ever come across who aren't zinc deficient. So it's definitely a must for any of these kind of conditions. Of course, excess testosterone is not only going to drive the DHT rate up, so assessing and regulating the production of excess androgens, which includes testosterone, this is important. Symptomatically, there are also a lot of things that we can do to help with the flow of urine and the associated anxiety that, of course, men face with these conditions. Other things to help or to keep in mind are aggravators like beer consumption and stress in general. And if these can be decreased, especially when they're dietary, then any treatment is going to be more effective.
So should men just start taking supplements to fix the problem, do you think?
Well, look, Jeff, I don't want to ignore the advancements that have emerged in the surgical world over the past decade or so. I mean, there are efficient operations now available that have a really high success rate and little side effects when performed correctly. The urethrotomy is one that opens up the restriction to the urethra, and there's you can get skin grafts as well, and of course there's always the option to remove the prostate. Although personally I see this as an absolute last resort.
So supplements?
No, yeah, sorry, you did ask about supplements. Back to the question. Look, yes and no. Going to your GP for confirmation and to test the progression is important if symptoms are well pronounced. All men should be looking at supplementation because we live in a world that's really not hormone friendly, and supporting these processes before imbalances occur really is the best form of treatment. But at the end of the day, practitioner supervision is definitely something that all men should seek out.
Okay, mate. Well, we might take a short break for a song, Richard, and